So welcome to Houston. This is the Texas Medical Center that you are sitting in the heart of it right here. And, excuse me. And Methodist Hospital is located, I don't know, I get confused, but it's somewhere in the middle over there. Yeah. Now, this is, it says one of the world's largest medical center complexes. It is, in fact, the largest medical center complex in the world, with 21 institutions, 14 hospitals, 3 medical schools. There's about 100,000 people that come into the Texas Medical Center every morning. So that's the commute that I have to face every day. And there's 100,000 that leave. So it's really a small city that sort of comes into work and leaves every day. And all of the other statistics noted over there. This Texas Medical Center is also famous for the rivalry between Dr. DeBakey and Dr. Cooley. DeBakey worked at this institution primarily. Cooley started working here and then moved across the street, literally across the street, to the Texas Heart Institute, which if you step outside you will see the two institutions are in fact connected by an underground tunnel, because for many, many years and even now a significant number of the private faculty work at both institutions. And of course, as is also well known, prior to his passing, just before he turned 100 years old, Dr. DeBakey and Dr. Cooley made up, and this is a nice photograph showing one of their many meetings he had before he passed away. You're in the Methodist Hospital, which has 824 beds, licensed for over 1,000. And we see more than 400,000 patients a year. You see the Methodist in 1924, and Methodist as it is today, which is a huge facility with many buildings that are all connected to each other. And in addition to the facility that we are in, which is almost a 1,000-bedded facility, we have 6 other hospitals located at all points of the compass in Houston. So the system itself is growing, and at 4 of these 6 hospitals, we have active cardiac surgery programs. You are in the Research Institute building, which you see over here, and you're on the 2nd floor where the auditorium is. And later in the afternoon, the labs will be held today and tomorrow afternoon on the 5th floor, the entire floor of which is dedicated to lab sessions and advanced learning. Mighty was really started over here by Barbara Bass, who is the chair of surgery, and it was in recognition of the fact that each of us spends around close to 40 years in the workforce, from the time that we graduate doing whatever we do to the time that we retire. And during that time, there's a constant need for relearning. And she actually had this vision, and the hospital provided the money, close to $100 million, to build this facility, which is used by industry, which is a very important affiliation and means to help pay for it and keep it budget neutral. And it provides us with a fantastic facility to stage conferences like this. So why re-evolution? Well, evolution happens over millennia, external influences, and it's out of your control. A revolution, of course, is a seismic event, dramatic change, and here's a famous painting of the French Revolution. Re-evolution is self-directed change, physical, mental, gradual. You want to avoid extinction. And if you want to do that, you need to re-evolve, constantly relearning, constantly re-evolving. But the truth is, the mechanisms to do so are not well developed. Most of the faculty over here evolved into minimally invasive cardiac surgeons through an unstructured approach. And we really sat and talked about this and felt that there was a better way to do this. And this conference is one small attempt to try to infuse an element of structure into how new things, at least in our arena, can be taught to those that are interested in it. So Dr. Cooley, of course, when the heart port procedures came out in the late 1990s, called it a stunt. He said they took something awfully simple and made it simply awful. And Reevolution is here to provide you with tools to help you change, make you aware of your capabilities, show you how to plan, practice, and teamwork is something which is going to be emphasized very, very strongly. A culture of safety really is key to the whole thing, and what we hope to do is to make something simply awful into something awfully simple again. This is a slide that Nirav Patel gave me. It's not the strongest of the species that survives, but the one that's most adaptable to change. Before we go into the first talk, I have some housekeeping notes, really. There will be dinner and entertainment at Wild West tonight at 7 p.m. It's a great country and western place. You'll have Tex-Mex food. We have a couple of dance instructors, and I promise you everybody's going to have a great time. Transportation will be provided. Please check the bus schedule in your agenda for times. We'd like to acknowledge our exhibitors who are really very important to the conference. Otherwise, it wouldn't be possible financially for us to be able to stage something like this. So please give them your time. Go there, visit with them. It is important. There are poll everywhere instructions. I don't know if we passed these around, but if we haven't, we will. Is there a slide for the poll ev? Can you put up a slide for the poll ev instructions? There we go. So a very important part of this conference is the interaction that takes place between the audience and the faculty. And many people have questions, but for whatever reason don't want to ask the question verbally. There are mics available for you to get up and ask questions, but if you choose to do so, this is an easy way that you can submit your questions. You can do it by going to the internet at that URL, but the easiest thing to do is just text. By texting 37607, type in Reev over there and your question, and it'll get sent to us, and it'll pop up on the screen so that the moderator at the end can look at the questions that have been sent and group them so that the faculty can answer them in that way. So without further ado, we're going to launch into our first session. I will say before we do that we are very, very excited to be doing this conference in partnership with the New Orleans conference with Joe Basha and Patrick O'Toole, who are perfusionists and who have really done a lot to advance education in the perfusion world. They host a conference in New Orleans every June, which is extremely well attended, and we have now blended that conference with ours, so we have a perfusion track which runs in parallel. So on Saturday morning, for example, we will have a perfusion simulator here, which will help in understanding and simulating perfusion disasters that can occur, that do occur, unfortunately, with minimally invasive cardiac surgery.